Hi, I'm Dr. Michael Bell. Have you ever been told your blood work looks completely normal, but you're exhausted every day, you wake up tired, you lose your energy by the afternoon, you struggle to focus, or just don't feel like yourself? Well, sometimes the problem isn't what your blood work shows, sometimes it's what's happening inside your cells. Today we're talking about cellular health. So I want you to think about your phone. When it's brand new, one charge lasts you all day. And then a few years later, it's the same phone, the same apps, but now you're looking for a charger before dinner. Your body works in a surprisingly similar way. Inside nearly every cell are tiny structures called mitochondria. Think of them like your body's battery factories. Their job is pretty simple. They take the food you eat, they take the oxygen you breathe, and they convert them into usable energy. That energy powers everything: your heart, your brain, your muscles, your immune system, and even your body's ability to heal and recover. But here's the problem: those battery factories don't stay perfect forever. Poor sleep, chronic stress, inflammation, environmental toxins, poor nutrition, and just simply getting older can affect how efficiently your cells produce energy. They don't usually develop one dramatic symptom overnight, but instead you wake up feeling tired, you hit that afternoon energy crash, your workouts don't feel the same, recovery takes longer, your thinking isn't as sharp, and you rely more on things like caffeine just to make it through the day. And one of the most frustrating things I hear from patients is, my doctor tells me everything is normal. Now, don't misunderstand me, standard blood work is incredibly valuable and we use it all the time. It does help to rule out many important medical decisions, but routine lab work isn't specifically designed to measure how efficiently your cells are producing energy. So while your labs may look reassuring, they don't always explain why you might feel exhausted, mentally foggy, or like you're running on empty. That doesn't mean your mitochondria are the cause, but it does mean there's sometimes more to investigate. One important molecule involved in cellular energy is called NAD. And NAD helps your mitochondria convert nutrients into energy that your body actually uses. As we age, our NAD levels naturally decline, and researchers continue to study how that decline may affect production of energy, recovery, and healthy aging. One reason we offer NAD therapy in our office is not because it's a miracle and not because it's a cure-all, but because for the right patient, it can be one valuable tool to help support cellular health. And it's always combined with the fundamentals: good nutrition, quality sleep, regular movement, stress management, and a personalized treatment plan. What I tell our patients all the time is you can't expect a battery that's been running on low for years to recharge overnight, but you can start giving your cells the support they need. So if you've been told your labs are normal, but you still don't feel like yourself, don't ignore how you're feeling. There may be more to the story, so ask us about cellular health on your next visit. We'd be happy to discuss whether NAD therapy or other strategies might be appropriate for your individual needs. I'm Dr. Michael Bell. Thanks for watching, and if you found this video helpful, give it a like, follow our page for more functional medicine education, and share with someone who's always saying, "I'm tired, but my labs are normal." I'll see you in the next video.